Hello, and welcome to the lecture series, Disability in the Ancient Middle East and Mediterranean. The program is co-sponsored by the Archaeological Research Facility at UC Berkeley and the Badè Museum of Archaeology at Pacific School of Religion. My name is Melissa Craddock, and I am Assistant Director and Curator of the Badè Museum. Before I introduce today's speaker, I would like to take a moment to read an introductory statement about this program on behalf of the Badè Museum. The Badè Museum is an institution dedicated to advancing knowledge of the archaeology and history of the ancient Levant. Over the course of a few years, we at the museum have come to realize that advancing such knowledge means reflecting on and engaging with perspectives that have been largely ignored by modern day society, and as a result, have been erased from mainstream historical narratives. The Badè Museum particularly welcomes scholars who are engaging with marginalized perspectives that contribute to creating better equity in scholarship and in society more broadly. This series, Disability in the Ancient Middle East and Mediterranean, provides a platform for such research on the experience of people with disabilities whose voices have been frequently overlooked in study of the ancient world. The program bridges past and present through the study of disability and antiquity, its contemporary reception, accessibility, and its continuing impact today, contributing to a more nuanced, inclusive, and complete narrative of the past. Thank you for joining us. With that said, it is now my great pleasure to introduce today's speaker, Dr. Rachel Kalisher. Rachel Kalisher is a postdoctoral scholar and lecturer at the University of California, San Diego. She's a bioarchaeologist of the Southern Levant, having worked, among other places, at sites of Ashkelon, Megiddo, and Qumran. Her research interests center on life history, kinship, and maternity in antiquity, which she explores through biomolecular and histological lenses. Rachel received her PhD from Brown University in 2024, concurrent with an SCM in ecology, evolution, and organismal biology. She has published in journal venues such as PLOS ONE, Cell, American Journal of Primatology, Biology Letters, and the International Journal of Osteoarchaeology, as well as co-edited the recently released Ashkelon 10 final report, which centers on the site's Philistine cemetery. Dr. Kalisher will be presenting on the topic of Brothers of Misfortune, a story of wealth and health at ancient Megiddo. Rachel, the floor is yours.
Thank you so much, Melissa. Thank you to the Badè Museum for inviting me for this awesome speaker series. As Melissa said, my name is Rachel Kalisher. I'm a postdoc and lecturer at UC San Diego. And today I am going to be sharing a little bit of my research, mostly based off of a paper that I published actually with Melissa back into 2023 called Brothers of Misfortune, a story of wealth and health at ancient Megiddo. Now, before I jump into today's talk, I just want to give a couple of notes. So the first is that Melissa mentioned I'm a bioarchaeologist, and what that means is that I study ancient human remains. And so because of that, there will be images of human skeletal remains in this presentation. And so I put this up now so that if you are particularly sensitive to seeing images of human skeletal remains, that you have the time to prepare. Now, this is a whole speaker series on disability and its reception in the kind of ancient Mediterranean Middle East area, but I think that it still bears relevance to define some of the terms that I'll be talking about today, especially how they relate to what I'm looking at in the skeleton. So disability is an umbrella term for the complex interplay between an individual and their society, particularly with respect to their physical or mental barriers that prevent them from an autonomous lifestyle. And what I want to urge folks to think about when they think about disability is that disability is a porous category. We all have moments of our lives where we are ostensibly disabled, which we rely on others. We depend on others to kind of get through the day, from infancy to elderhood to illness or pregnancy or injury, right? So people can move in and out of that disability category. But that is a completely separate thing from healthcare, right? And I think of healthcare as the kind of social response to disability. These are the provisions of assistance to an individual experiencing a disease or disorder related ability. And we have tons of evidence that in antiquity, there were these kind of codified systems of care. We have not only like medical texts and other types of treatment manuals, but we have all of this evidence from the material culture of objects that would be used to treat individuals with illnesses for surgical practices and whatnot. Um, Now, we don't have a ton of direct evidence for what people might have been doing as an anesthetic at this time. It just depends on the time and place that one is working archaeologically. But for instance, a surgical procedure might have been done with using medicinal herbs as some kind of anesthetic or sedative. Now, as a bioarchaeologist, I work with skeletal remains, and talking about disease, disability, and whatnot, and healing kind of requires a preamble on this foundational premise in biological anthropology, which is the osteological paradox. So the osteological paradox is a term put forth by Wood and colleagues in the early 90s. And it is founded on this principle that bone is always remodeling. It's always changing. So right now, me sitting here, you sitting there, 10 years from now, if you're watching this on YouTube, your bones are constantly in a state of flux and change. And it is essentially this normal maintenance that our body does. And I use this image here, which is a very kind of sciencey looking image of the bone remodeling cycle, where we have cells that come and they break bone down, and then that kind of triggers other cells to come and put new bone in. And you can just think of it as like a cycle that's just constantly going. So when we are responding to stress, whether that is illness, whether that is something like pregnancy, or even psychosocial stress, anything that kind of disrupts the balance in our body, usually has some kind of adaptive mechanism. The skeleton usually has some kind of adaptive response to it. However, it is not an immediate thing. So it's not like you get a really, really bad flu and your bone is suddenly like, okay, we're going to record the flu right now. It takes some time to respond. And so what this means for us when we're looking at disease and pathology in the ancient world, and specifically through the lens of the skeleton, we have to recognize that when we see a lesion, or even a prolific set of lesions, like this example of an individual with metastatic cancer. So you can see these lesions that had completely kind of spread throughout the whole part of the skeleton that's visible here. When we see a lesion, what this means is that the person had survived long enough for those lesions to kind of manifest in the skeleton. And so a person who might have had, let's say, metastatic cancer that does not show evidence of these lesions probably died before they were able to attain that extensiveness of the lesion spreading. So it's something important to think about when we are looking at past peoples, that when we see disease, it tells us that they might have been sick, but it doesn't tell us about the others in the society that might have not been sick. So with this, I also want to kind of lay out that there are limitations of skeletal data. So not only because of this paradox are we unable to see things like short-term illnesses or sudden systems failures, right, from like a heart attack or a stroke, but we also don't see anything that's not recorded in the skeleton. So conditions like being blind or deaf or mute. We don't have any kind of direct correlate for cognitive and personality disorders. So there's a whole kind of aspect of past people that we cannot access by just looking at the only by very nature of what we do, looking at mortalities. We are only seeing the people who did not survive their illness. And so the catchy title of wealth and health in my talk title is a little deceiving, because health is really this slippery, almost existential topic that we cannot approximate from the skeletal evidence, because we do not see the healthy people who survived. We only see the sick people who died. So with all of that said, now we move into the regionally relevant portion of this talk, which is that this is a talk or a speaker series rather on disability in the Mediterranean and ancient Middle East. And so I show you this map of the ancient Near East in the late Bronze Age period, roughly 1500 to 1300 BCE. And what you can see is that there are a lot of large kingdoms, cultures, societies throughout this region, kind of extending from Egypt through the southern Levant up into the northern Levant, and then west into Anatolia and east into kind of Mesopotamia region. And this is an important thing that I also want to mention because this is a really important period overall in the region. The Late Bronze Age is this period in which we see kind of this explosion of international trade and connections. There's famously the archive at Amarna in Egypt, where there's all of these administrative letters kind of going back and forth between kingdoms in all different parts of this region. And so we know that there was a lot of sharing of ideas, sharing of resources, and that kind of lends itself a little bit to the argument that I'm going to make about, transfer of knowledge, transfer of information with respect to healthcare. I'm going to be focusing on the site of Megiddo. Now, Megiddo is in the southern Levant, in the country that is modern day Israel. And so we are going to zoom into this part of the map and focus on this site. So Megiddo, you might recognize as or might sound familiar rather, as the biblical Armageddon. This is coming from the Hebrew Har, which is mountain. So Mount Megiddo, Har, Armageddon. And Megiddo is a tell site. So it's a multi-occupational site that is this artificial mound that has kind of accumulated over millennia of use over and over and over again. This image on the left is it looking really beautiful and lush. And Megiddo is this super important site for the ancient Near East in general, not just because it has this kind of historic relevance, but it is one of these major cities that surround the Jezreel Valley. That's what you're looking at on the right image. There's kind of this bowl that forms, and all of these major powers kind of dot the landscape of the bowl. And Megiddo specifically was along this trade route known as the Via Maris. So it was kind of in control, so to speak, of movement of goods between Egypt and Mesopotamia. And so it exerted a lot of control over what was happening in the region in this way. And what that also means is that you could very easily have people coming in and out of the city. And because of this, we can think of it in the Middle Bronze Age specifically. So just before the Late Bronze Age, the Middle Bronze Age, which started really around 1900-ish BCE. It was a very cosmopolitan and a very densely populated area. It became slightly less so in the Late Bronze Age, but the Middle Bronze Age is really where it started to become much more populated. And we see this in the evidence from all of the domestic structures that have kind of popped up in this period. And what's interesting about this particular period as well is that as we have all of these houses that are being built up, we see this new tradition, or at least this, let's say, this resurgence of a tradition known as residential burial, where people were burying their dead under house floors. We see this in a lot of different forms. So, for instance, we have jar burials. So this is an example of these were twins that were buried together in one jar. We have simple pits where people were kind of just put into simple pits beneath their house, and then also these tombs, which are usually stone or mud brick that lines the burial, and the person is put in it and then covered in some other way. And what's interesting about this custom is that these were people buried beneath their houses when the house was still being used. So is a certain amount of memory that would have had to go into selecting a location, that there would have to remember where people are, right? If you're going to go and pay respects. So this is a very interesting phenomenon. We also have this very different type of burial, which we call masonry constructed chamber tombs. This is a particular tomb that is has been really well researched by Melissa Craddock here. This is tomb 100 from Area K. And what you can see here is that as opposed to the other images that I just showed you, here we have this giant tomb where a lot of individuals would be buried over and over and over again. And so this was by design made to be opened as individuals died and needed to be placed in it. And what you're seeing on the left is the kind of before and after images of this tomb. And then what you're seeing on the right is the kind of what it looks like inside, where you have this amalgamation of pottery and objects and bone that just kind of happens from the use over and over and over again of this tomb. And I introduce these because they will have some amount of relevance for the case study that we're talking about today. So this is an image from Neolithic Çatalhöyük. This was a practice in that area in that time period. This is not exactly what the house would have looked like at Megiddo in this period, of course, but it's just to kind of illustrate or bring home that these people were buried underneath a very lively space. And so it was a very intentional integration of the mortuary landscape with the living landscape. Now, where I'm focusing on today is that in this area called Area H. So Area H is in the what we might think of as like the elite sector of the city. This is where we have the city gate. This is where we have administrative buildings. This is where we have evidence of palatial kind of architecture. And so Area H's proximity to this kind of elite sector, as well as all of the other things that kind of give away elite status, right? Like really nice masonry and fines and all of this stuff. All of this tells us that the house that was in this area was one of the elites. Whereas all of the images that I just showed you of burials at Megiddo come from a middle class house in Area K on the other side of the city. And so this image on the right is showing you kind of how Area H fits in with University of Chicago's Area AA. So you can see how kind of the architecture lines up really well. And specifically, this trench, while being very narrow, has revealed an incredible amount of information about the city and how it operated in the Middle and Late Bronze Age. So this is an image. The guys that we want to talk about today are these two individuals here in the red circle. But I do think that it's necessary to contextualize what we can learn from them with the people that are buried in this area, which is the blue circle. So this blue circle contains a tomb, which we call very affectionately Tomb 50. And this was an incredibly beautiful constructed chamber tomb, much nicer than the one that I just showed a few slides ago from Area K. This is a reconstruction of what it would have looked like with this dromos area going down into the tomb. And this tomb dates to the terminal Middle Bronze Age, so Middle Bronze Age 3, or around 1650 to 1550 BCE. And this tomb, this is showing you just like a smattering of images from this tomb. You can see that there are dozens of vessels kind of clustered at the front. There's this beautiful corbelled architecture. We have individuals with jewelry still in situ. There have been a number of studies that have come from this particular tomb, including one of the earliest publications on evidence for vanilla in some of the ceramics in this tomb, which is kind of unheard of in the region, thus kind of lending this idea to a prestige item. There was another follow-up study that our colleague Ayala Amir did, where she was looking at the amount of wine that was in some of these vessels. And so we have evidence that there was like really, really nice stuff that was being housed in these vessels, not just the vessels themselves. This tomb is so awesome that it, in fact, is the kind of main subject of Megiddo 7, this tomb and the one that I'll be talking about, which came out last year, co-edited by Melissa Craddock. You can see here this reconstruction of a bone inlay box, which is honestly one of the most incredible things that I think I've ever seen. And so this tomb is just really pulling out all the stops with respect to just really nice items, really beautiful architecture, just things that you don't usually see in a less elite part of the area. And this tomb had 3 primary burials within it, which means these are people that were just laid down and were not disturbed after they were buried. There was an adult male and adult female. So the adult male is in yellow and the adult female is in green. And then just beneath the adult male, but kind of in the opposite direction, was a female child. And we know that this child was a female. We know all of these sex estimates because of ancient DNA, a very robust ancient DNA program that we have at Megiddo, and we will be publishing a more updated version of that somewhat soon. So we have these 3 primary individuals in this tomb. They are buried with beautiful object, beautiful gold diadem and necklaces and pins. The adult female had this unbelievable line of shells, perforated shell beads that were just around her waist area, so probably some kind of belt. And we also have at the very back of the tomb this very densely commingled pile of disarticulated skeletal remains. And this is a pretty common thing that we see in the area, especially with respect to these chamber tombs. People would revisit these chamber tombs when they are opening it up for a new burial. And then if they encounter remains that had pretty much fully decomposed, they would just move them to the peripheries of the tombs. And so this densely commingled pile of individuals ended up yielding an additional kind of dozen people or so for a final minimum number of 17 individuals that were buried in this tomb. And you can read more about the osteology of this tomb context in Megiddo 7 if you are so interested. Now, what it means for us in this idea of disease and disability and healthcare is there are extensive signs of pathological lesions in this tomb, both in the individuals, the primary individuals, and those that were buried secondarily in that commingled context. And these are things from, degenerative joint disease, so living to older age. These are things like potentially blood packing disorders. We have evidence for infectious disease and contact facets from kind of repetitive labor. So all of these things kind of point towards being able to live for a long time with certain types of conditions such that it appears in the skeleton, right? Going back to the osteological paradox. And I will note that as the bioarchaeologist at Megiddo, I have also done the skeletal analysis for kind of comparable burials in other parts of the tell. And these are examples of lesions that we just don't really see in other areas. And so the likelihood is that everybody was probably dealing with the same types of illnesses. It's just that not everybody was able to live with them. So that's the context. That was the tomb 50. It was from the Middle Bronze Age 3. Now we move on to the brothers of misfortune, so to speak. And that's these two individuals here in the red. Now, these two individuals date to the phase immediately after the tomb. They date to the late Bronze Age 1 period, around 1550 to 1450 BCE. And you might look at least the photographs and say, I don't see two people here. And the reason for that is just like in Tomb 50, where the folks at the very back of the tomb were disarticulated and commingled, that's what's happening here. So you have one individual 1, who's this blue person that's laid out in a primary burial. And then you have this other individual, who's individual 2 in green, who had previously decomposed and then was collected, rebundled, and placed in the burial with the individual 1. In addition to these two humans, we also have some non-human bones, some vessels. Altogether, it's a very interesting assemblage. And what's also interesting to note is that if you look at the image on the right, you can kind of make out there's these, I don't even think I can point to the screen, but you might be able to make out that there is an articulated foot and leg in that pile. And so what that means is that the entire body was not fully skeletonized when it was at least excavated and or gathered up and put into this burial. So I'm not entirely sure how much time elapsed between the deaths of these two individuals. It depends on a number of factors when we're trying to estimate decomposition in different types of environments. But it wouldn't have been necessarily like years and years and years. It was probably that they died not so far off from one another. And just like Tomb 50, these individuals were buried with some pretty nice things, some really beautiful decorated pottery, gold, beads, and other types of fashions. So we know that these people were elite, not just by proxy of them being in this same house, buried beneath the same house as Tomb 50, but that they are just kind of afforded a lot of the same things that we would expect to see in an elite household. Then when I say that they're brothers, in a 2020 article that we did in Cell, which was a genomic history of the Southern Levant, these two individuals were identified as brothers. So they are both adult males, and they were buried at the same time. Sorry, my coffee maker's going off. So Let's start with the individual who died first. So this is individual two, the person in the bundle. When I do a skeletal analysis, I usually just start. I open up a bag, I start looking at the things, and I make notes of them. And this was one of the first things that I saw with individual two. We usually have three molars in each quadrant of our mouth. The third molar is your wisdom tooth, and this was an interesting case because I knew that this person was an adult. But on one side of their mouth, they had only two molars. And as I continued to clean, I noticed that there was this little kind of thing peeking through between those two molars. And what that was an unerupted odontogenic cyst. So you can see that's what is in panel B here. This is a tooth that has been kind of never erupted and then just kind of accumulated hard tissue material around it. And so it stayed in the jaw. And as a result, the third molar, which you're seeing in panel D, had this nice little impression in it. Now, teeth are a really interesting thing for us to think about because teeth are, they erupt in this kind of epigenetic pattern. So we have these signals that we get in utero that are telling our teeth how to form and when to form and whatnot. And so when we see dental anomalies, these are typically referring to something that already exists in the person's epigenetic landscape, right? So a dental anomaly is something that we think of as a congenital situation. This tooth would have theoretically erupted around 12 years of age. So it was already forming in earlier childhood. So this is something that was affecting this individual from very early phases of their life. Now, there are also kind of diffuse signs of disease throughout the entire skeleton. Without even necessarily knowing what a normal bone looks like, you can appreciate that all of the images on the left are showing pits and lines and porosities and openings that are not typical to bones. And these are going to be telling us something about the body mounting an infectious response. So it's going to be the bone is basically compensating for the imbalance that exists in the body. And so it results in these types of appearances here. And then on the right, what you're looking at are two parts of the nasal area. So these are the proximal portions of the maxilla, right? So these are the bones that kind of frame around our nose. And what you might be able to see, or maybe not, from the yellow arrows is that there's a lot of erosion of some of those surfaces, including that surface that would articulate theoretically with the other maxilla and the kind of the nasal aperture itself, which gets very thin and wispy. And I'm going to revisit what all of this means in a couple of slides. So if I had to just basically give a presence absence of types of lesions that we see on individual two, that's what this table is showing you, that we have large portions of this individual's body are showing evidence of some kind of pathological lesion. And if it's all over the body like that, especially bilaterally, that's telling us that the thing that they are dealing with is a systemic infection. Now, individual one is the individual that was in their primary position, and they too had a dental anomaly. Rather than having one less tooth that had erupted, they had one more tooth that had erupted. In their right upper jaw, they had a fourth molar, and that's what you're seeing there. This is also telling us something about their developmental situation because teeth are those highly patterned. And highly heritable, right? So it makes sense that these two brothers both had some kind of dental anomaly. We also see the retention of a suture in the cranium known as the metopic suture. This is a suture that bisects your forehead, and in most individuals, it's completely fused in infancy, but you can retain it into adulthood. So we have these two kind of congenital things for this individual, the extra tooth and the metopic suture. And then we also have evidence that they had a broken nose at some point. You can see it on panel C here with this tiny little healed fracture. And then if we look top down onto the cranium, you can see that the nose has completely shifted to the left. So this would have been pretty outwardly obvious change in this person's facial appearance. Now, just like their brother, we see extensive pathology and porosity on this individual's skeleton, especially on joint surfaces. We see evidence of periodontal disease. We see those lines, we see those pits, those crackings. And so, very similarly to individual 2, individual 1 has this bilateral and systemic instance of some kind of infectious disease response. Now, what's most obvious about individual 1 and where the healthcare aspect of this talk comes in is that individual 1 had this large trephination in the middle of their forehead. And that's what you're looking at in the reconstruction on the right. You can also very clearly see that suture that is going halfway through the forehead here. And this is a procedure. Trephination or trepanation is a procedure where there's an intentional removal or excision of cranial bone. And civilizations globally have practiced trephination. There's a lot of different ways that you can perform trephination. That's what you're looking at here. You could use a stone and scrape away along the curvature of the cranium. You can chisel circular grooves. You can do burr holes, or you could do what we're seeing here, this practice called linear incisions, angular notches, however you want to call it. It's basically when you do a series of lines that intersect. And if we look at the trephination here in high resolution, we can see not only are these edges super fine, but that we have evidence of the scalping, the removal of the soft tissue on the cranium prior to accessing the bone itself. There are these in panel A, you can see these little scratches. That's what would have been kind of the remnants of the tool. And then in panel B, you're seeing the sharpness of this cut. So this would have been a really fine instrument. I don't know whether it's made of stone or metal. I would have to do further analyses in order to test that. But whatever it is, it was an extremely sharp instrument. And what's super unique about this context is not only did we find an individual with this opening, but we found the actual pieces that were removed from the opening, or at least we found 2 of them. That's what you're looking at here. You can see that I tried my very best to refit some of the pieces in a way. So you could also see that this was not just one square that was cut, it was a series of cuts that were happening. And I do think that it is important and worth mentioning that we have a cut that started just next to that metopic suture, which you might be able to see at the top of panel A, because sutures were not typically trephined along because they increase your likelihood for hemorrhage. And so we see increased fatalities when people trefine along sutures. And so the fact that the metopic suture was there in this individual would not have been something that would have been known until the soft tissue was removed and opened. So I do think that it's an interesting kind of interplay that I'm not going to go into much here. These are just some other views of the same pieces. So you can see on either side of them these really fine edges, and that we had these 2 pieces all together. If I were to reconstruct the kind of shape of this opening, it's pretty exact. I mean, obviously it's not perfect, but we do have some pretty nice right angles, including that one on the top left. And these are just some other views where you can see how deep these tools would have gone into the bone before stopping, and as well as appreciating some of the other more minor scratches and incisions that would have been left on the bone itself. Now, the way that this would have been done is by using that sharp instrument and just cutting those intersecting lines and then wedging out with leverage as necessary. So the ultimate final size of the opening is kind of decided upon by the practitioner, and can be essentially expanded upon if necessary. So once you have your initial opening, you can continue to expand it if need be. Now, this particular trephination type is not very well attested in the archaeological record of the Southern Levant. I've only been able to find these 3 examples that come from much later periods. So the first set are 2 individuals from Lachish, and you can see that they are both done on the back of the head. So the one in A is done on the kind of back right, and the one in B is done on the back left. They both kind of hit over the suture a little bit, so or approximating sutures, but not necessarily to the same degree that the individual at Megiddo is. And the other example is from Timna, which the authors of the study say dates to the Iron Age or the Roman period. And it's not that different of a location, this Timna trephination as the Megiddo individual. It's just that in the Timna individual, there was no metopic suture. So it's not crazy to believe that this was a location of the head that people might have trephined upon. It's just that in this situation, there was the complicating factor of having that suture present. So I know that there are a ton of questions that kind of arise when I introduce this case study, because there's just so many ways that it can go. And unfortunately, for all of the issues that I outlined at the very beginning of the talk, there are so many limitations with what we can actually say. One of the questions, like, why would they have been trephined upon in the first place, right? All of these things kind of get speculative after a while, because we don't have the texts that say, so and so had so and so, and so we called the doctor and the doctor came and they did this. So we don't have that type of record. So everything that I presented here on out is kind of trying to make the best educated guess. So the first question, what diseases or syndromes did the brothers have, and was it the same disease? So in bioarchaeology, what we do is we produce something called a differential diagnosis. And that's because there are lesions that look the same for different types of diseases. And so what I'm trying to do here is just present you some of the options that we have. But I want to really focus on the one that has kind of gotten the most attention, and that is leprosy, because there are certain skeletal changes with leprosy that are unique to leprosy, including the erosion of the nasal aperture. So that's what you're seeing in the image on the left. Those were that erosion of those joints. And that's what you're seeing on the image of the right in this individual, a known leprosy case. So you have erosion of the nasal opening, as well as erosion of the upper maxillary arcade. And this is another example that's kind of showing a very similar process in an individual with leprosy. And we also see with leprosy these kind of systemic infectious responses. So in the skeleton of these individuals, you'll see all those little porous lesions and bony growths. And that's not so dissimilar from what we're seeing in the Megiddo case. The other kind of weird clue from Megiddo is that the bones of the foot of individual one had a very strange appearance to them. They were kind of pinched at the end, and they had these little pinprick almost depressions in them. And so for me, I'm thinking, well, maybe this is relative to leprosy as well, because in leprosy, there is erosion of the digits, the fingers and the toes, and this kind of results in this penciling effect of the digits and the bones of the hands and feet. And so that is kind of my best guess as to explain what we're seeing here. So the differential diagnosis of the infectious diseases includes leprosy. It could also be something like tuberculosis or osteomyelitis. I don't have a great differential diagnosis for the congenital situation, because unfortunately there's not a lot of information out there as to like what conditions have both dental anomalies and metopic sutures. So it's a much weaker argument to say that they necessarily had something that they were dealing with since birth, but it is clear to me that they did have some kind of anomalies that they shared. And as for, did they have the same illness? We don't know for sure that they had the same illness, but if they are genetically related and they lived together, it does stand to reason that an infectious disease could have affected both of them. The same infectious disease could have affected both. Why were the removed pieces kept with the body after death? We don't know. That's the short answer. There are not a lot of examples in the archaeological record of, there's a lot of examples of trephinations, but there's not a lot of examples where removed pieces are kept with the head. One example here is from Cusco, Peru, published by Verano and Andrushko, where they found this female with a trephination that the removed piece of bone was put back into the opening and covered with kind of like plant fiber. And they also say in their publication that this was the first example that they'd seen of it. And so they are speculating that maybe this was meant to be medicinal, or maybe the thought was that it would help heal the wound a little bit faster. There's another example from the UK of this large round trephination where that roundel was put back into the head. There's not really a great explanation for this. We can't, I don't think, separate like a magical or a medical or a religious intention with this. But I would hypothesize that it was an attempt to try to close up the hole faster by giving it more meshwork to latch onto. Whether or not that's medically true or not is kind of beyond the point, but like the intention was to keep the person whole or to facilitate the healing of that opening. When we ask about was individual one alive during the trephination, this is a very tough question to answer. It's pretty easy to know whether somebody really survived an injury or was very dead when the injury happened or when the damage happened. But this very specific threshold of like just alive or just dead is very difficult to tell the difference between. Gonzalez Darder kind of puts forth in his paper on trephination that there are these kind of clear signs that we can see to try to estimate how long a person had lived with their with the surgical procedure prior to dying. So for instance, if you die immediately or the trephination is done immediately post-mortem, you're going to not see any signs of a biological reaction, right? That remodeling process that I mentioned at the very beginning of the talk is not going to be able to take effect. But around 1 to 4 weeks, you're going to start seeing an infectious response to that insult that occurred to the body. So you would start to see this superficial osteoporotic ring around the opening. Ultimately, there will be bone that dies because it's been cut off from the blood supply, and that bone will die off. And then around 8 weeks, you start to see remodeling really happening where edges become smoother and more regular and round, and it might even be new bone growth in that area. So obviously, in the case of individual one, we don't really get to point 2 on this list. We don't see any signs of a biological reaction. And so whether or not we can say this person had the trephination when they were alive or just freshly dead is very difficult to say. But I argue that they were alive or at least conscious when this procedure happened, because there is care to not completely go through the cranial vault. So we do see this maintaining of that intracranial bone. Now that could just be an artifact of the wedging process and leaving a little bit of bone there on the bottom. But I take it, in combination with the fact that those excised bone pieces were kept with the body. And so perhaps kind of trying to facilitate healing, as well as if we contextualize it with the extensive pathological lesions on this individual, it could have been this intervention. So this individual was dying. If they did have the same disease as their brother who had died and did not have a trephination, perhaps this was kind of a last-ditch effort in order to save the person. So if we were to kind of piece all of this together, we can think about all of this data as showing that brothers were able to survive to adulthood, enduring maybe a congenital condition, but certainly an acquired infectious disease. This indicates that they had to have been provisioned with adequate care that might not have been afforded to those of lesser status. The fact that we don't really have that many instances of trephination, we have only these 3 instances of the similar type of trephination, but only something like 12 examples of trephination in the Levant in all of archaeological history. So this is not something that people were just getting done constantly. And so this is telling us something about access. I also want to emphasize that these 2 individuals were not othered or separated from the traditions of their contemporaries. They were buried beneath their house in a time when the house was still occupied. So they were still incorporated into the kind of household memory by being buried beneath it. They were buried in very close proximity to the clearly elite Tomb 50 with fine offerings. And I also want to emphasize that there was care taken to inhume these 2 individuals together, even though they had died apart. Right. So this was a very intentional choice with whoever buried individual one to bury him with his brother. And so if you want to read more about this paper, I direct you to +1. This is where we first published the evidence. You can also check out the Megiddo 7 excavation report, which has more on the kind of nitty-gritty details of the skeletons from both the brothers as well as from the tomb. And with that, I want to thank you for listening and thank my collaborators and funding partners.
Thank you so much for that fantastic talk. It's especially awesome for me to be listening to you present this research because we published on it together. So it's just wonderful to hear it get this visibility and interest. So I'm going to start us off with a couple of questions for you. Um, and most of them are methodological. So the first question relates to the example that you showed of the brothers of misfortune, and perhaps applying my question to them. So the question is about ancient DNA. You mentioned that these two are genetically related based on DNA testing and analysis. So I'm wondering what role ancient DNA plays in testing for disease markers or predispositions to certain diseases and disorders, in addition to just simply, not simply, because it's nothing about it is simple, but in addition to, let's say, mapping a genetic code and linking people together who are genetically related? And could ancient DNA, has it yet been a helpful line of inquiry and analysis for addressing disease and pathology and other medical questions in the past?
That's a great question. So, ancient DNA, especially from human skeletal remains, is something that we've only really been able to start accessing in this region once we started looking for DNA in a different location. We used to sample like large, robust bones like the femur or the humerus for DNA, and it was not particularly DNA was not well preserved in those bones. And so once we started sequencing this portion of the cranium called the temporal bone, or the petrous portion of the temporal bone, this is where we see like really well preserved DNA. So because of this, we've been able to access the kind of genomes of ancient individuals. So with the particular example of these two brothers, we are able to kind of estimate through the amount of preserved DNA from both of them, their biological relationship to one another. As for whether or not they had any kind of congenital conditions that would have manifested genetically, that is something that kind of requires a different set of skills from researchers that are like trying to work out these questions. There's a group of researchers at the Max Planck that I believe had started working on this. I don't know the status of that study yet, but that is, they would basically have to comb through the genome to see if they can find markers consistent with, disease A or syndrome A, B, C, or D. As for the actual pathogen, so the leprosy, for instance, is caused by Mycobacterium leprae, and so that is a specific bacteria that is its own pathogen. It's its own living organism, and so if you're going to find evidence for those for that type of disease, you actually have to find the DNA of that pathogen itself. And so people have successfully sequenced pathogen DNA from things like calcified dental plaque, dental calculus, as well as from actually just the lesions on the bones themselves. There's this idea that, especially with something like leprosy, that there's the skin, the layer of tissue that is touching the bones is infected. And so if it, like at the area of the lesion, you could sequence that and theoretically find that pathogen DNA. My understanding from the study of these two individuals who we did send for that type of analysis was that they did not find any evidence at all that there was any kind of pathogen on their skeleton. However, because we see this reaction, this response in the skeleton, we know that something happened. So I think it's just a matter of preservation when it comes to the pathogen DNA. But it is certainly possible, and people have done this with all different types of diseases. Like Yersinia pestis has been something that, for the Black Plague, that people had been really trying to find evidence for and have successfully found evidence for. So it's certainly possible. It's just DNA is this like huge frontier that requires so many different skill sets in order to wade through the type of information that you're getting and make sense of it with a socially relevant conclusion.
Yeah, thank you. I think, yeah, the plague is a great example that has gotten a lot of media attention, although a bit different in that it's communicable as opposed to, let's say, a congenital disease. But yeah, it sounds like it is quite a complex sort of issue. So, a similar sort of question. What are some of the methodological challenges of identifying ancient pathologies and diseases and disorders based on, let's say, their modern names, their modern symptoms and bodily expressions, the way that they're understood in today's primarily Western,
Mhm.
global North medical framework? And I know that's a really big question, but could you speak broadly
Yeah.
about that issue?
Sure. So, pathogens as living organisms are going through their own evolution kind of alongside us, right? So the way that a pathogen behaved in the past isn't necessarily the same way that it would behave today. Usually on the scale, like for instance, the scale of what we're talking about here, so let's say like 4,000 years max, you can kind of imagine how much evolution is really happening in that period of time within that pathogen. But so it's kind of like a known thing in bioarchaeology that we expect to see similarities to what we see today, but not necessarily like a full one-to-one relationship with what we see today. The other thing that makes it really challenging is that most of the time that we think about diseases is in a clinical sense, and in the clinical context, people are just trying to heal patients. They are not necessarily like looking at their bones and seeing how any different type of disease is manifesting in the bone. So we don't have like bioarchaeologists and paleopathologists are kind of getting the dregs from clinical data, trying to understand if we can find relationships between a skeletal response and some kind of lived experience with a disease. So there's a lot that we just don't know. And if you think about like medicine today and you were to open up a clinical journal, you'll see that like there's just so it's like a never ending list of possible things that we as humans can contract, can be born with, can experience. And we just will not, I don't know if we'll ever have that same clarity. I can't imagine we would in the ancient world. So I think that there are a lot of things that kind of have only developed in modernity that come from this like increased urbanization and close contact and different introduction of different foods. Like we have all of these different rates of things and new types of diseases and pathologies that we can see today. But there was certainly more in the past than what we're able to see, right? And people can, I know that like a lot of folks look at disability through other types of media, right? So I'm talking about the skeleton, but some people look at text, some people look at art. um, there's just so much missing from what we're able to see. And so I think that one of the challenges with doing these types of studies and trying to understand, what was a social reaction to a disease or what was the prevalence of a disease, it's just really difficult because we're just kind of missing everything else. Like we as archaeologists and historians are kind of just seeing either what was purposefully put out there or what was kind of unintentionally left behind, but we don't see anything in between. So it's just tough. And paleopathology is a very tough thing to look at because, as I said at the beginning of the talk, so many lesions, so many similar lesions are present across different types of diseases. So you're never, I don't know at what point we'd ever get the smoking gun to say like this is 100% this, maybe if you had the pathogen DNA, but for the most part it's a lot of guesswork. And so it's just difficult. I don't know how else to say it.
Thank you. So we're just about at time, so I'm gonna ask one final question, and that has to do with pain and pain response and medical interventions to pain. Do we know
Hmm.
anything about the methods, if any, for numbing pain or using any kind of anesthetics for individuals who were subjected to these kinds of surgical and other intensive and potentially painful intervention.
Yes. So pain is another just like health, pain is a very tough thing to measure because we have no real way of quantifying it. Um, Certainly, just cutting into somebody's head and bone when they're alive and coherent would be pretty horrendous. Um, and it's possible that this was just how it is. You know, if I think about like Civil War surgeons, right, who have to just like kind of act as needed in order to act really quickly. So I think it's possible. I think that the likelihood is that they were using other kind of things in their environment to numb the pain, whether that's alcohol, right? I mean, I think most people feel pretty good after a few drinks. So if you just get really, really drunk, you know, it might kind of numb the pain from the procedure. We also assume that people were using, you know, medicinal plants or hallucinogenic plants. Certainly, like opium or from poppy plant is possible. So as for like the actual numbing aspect or preventing the kind of physical pain while like coherent and awake. I don't know that I could speak to that, but we certainly know that there's mind altering substances that would have existed in this period that could have been used to kind of knock the person silly before going through something like this. And if it was the case that this person had just died, you know, like they passed away and then immediately this procedure happened, you know, obviously that would not they wouldn't need to do anything specific for it. But I think that people were pretty resourceful in trying to find ways, especially for like an elite person who you wouldn't want to necessarily put through something so horrible. Not that you want to put a non-elite person through it, but you know, like there was probably more resources available to try to mitigate the pain and risk involved in a person who had the like wide financial resources to deal with it.
Yeah, thank you. And I'll just add to that that even at Megiddo, in a contemporaneous tomb context, Tomb 100, which you showed towards the beginning of your talk in the middle class neighborhood of Area K, residue analysis, so basically testing for chemical components of the residues in ceramic vessels, has identified traces of opiate chemical components. Um, so in an oil lamp, so potentially suggesting fumigation, at least of the tomb context, perhaps related to a funerary ritual, not necessarily a medical intervention, but we know that these substances are around. You also mentioned Ayala Amir et al.'s, one of those et al. Co-authored studies on the residue analysis, identifying traces of wine, same with Vanessa Linares in these tombs. So we certainly know not only that these substances are around to alter minds in various ways, but they are readily available to the very people that we see buried in these tombs. Now, whether or not that was applied in medical settings, we can't say. But
Yeah.
um, so that is it concludes my question. I saw Aaron put himself on camera. So before I conclude, I just want to give you a chance if you wanted to say something.
Oh, I mean, well, first of all, Rachel, thank you. This was a fascinating talk. Um, as an outsider to bioarchaeology, I I personally would be a little less hesitant about, I mean, of course, we don't know if this individual was given, some concoction made with opium, but we know that it was traded in the region, certainly in the late Bronze Age, if not preceding. Um, and yeah, I mean, so I happen to have excavated a contemporary, or at least an LB1 tomb at Ashkelon,
Mhm.
where the Cypriot um, ceramics that sort of imitates the form of an opium poppy, head was even located there. So, again, I mean, in this case, um, the skeletal remains were studied and published, and there was no, evidence of any kind of uh, well, what a non-professional would call disease or marks left on the bones, whatever. Um, but uh, it certainly was plentiful, especially along the coast. And then, Megiddo isn't that far from the coast. Um, so I would hazard that it's not even a guess, it's an inference, that and of course, they probably didn't call themselves doctors, but whoever was
Yeah.
treating, your particular individuals, had a wide array of not just imported items like opium, which I would again presume is stronger. I've never taken any myself personally, but um, but I mean, there's later evidence that there was that there were cannabinoids in the area, that people were smoking dope. Um,
Hmm.
so and of course there are local herbs, and then we already spoke about the wine. So any combination thereof would certainly help dull the pain. I know it has for me. Got me partially through graduate school. So that's a that's a different kind of pain. But if you understand what I'm getting at, I appreciate your hesitancy. But I mean, the whole thing about modeling is that none of us, whether it's human skeletal remains or studying, burials in general, or ceramics or animal bones, none of us have a full picture, or even text, dare I say,
Hmm.
because when one turns to a text, it may be an individual example, but who knows
Hmm.
what's happening, 15 years before that text was finally written down, or
Yeah.
100 years after.
Yeah.
So, but we have parallels in terms of medical texts from Egypt, probably contemporary with the Late Bronze Age. But again, I'm
Hmm.
not familiar with that corpus. Um, so one can begin to hazard, I would say, inferences, as to the kinds of painkillers that were. I mean, again, that's a modern term, right? Or
Yeah.
when we think of opioids, we don't think of it for necessarily for the control of pain, but it certainly was both available. I'm sure there are Roman texts that talk about all this stuff in much
Yeah.
depth. Again, just because the preservation, right, from a later period,
Yeah.
the Roman period, and especially the textual corpus, is so rich. And in some ways, it's a way of doing, um, ethnoarchaeology. And
Yeah.
yeah, sorry, I'm forgetting the apologies. I'm forgetting the name of the researcher at Yale who's trying to work on essentially ethnopharmacology, and then
Mm.
compare it with ancient remains and the analyses of what was actually in the jars, just as your colleagues did for the wine jars and the vanilla or vanillin that was present in some of these tombs. Uh,
Mm.
but again, even the wine or the traces of vanilla, or later on, we have evidence for cinnamon, for instance, which is, of course, we all think is tasty in terms of sprinkling it on top of our mochas, or putting it on cakes, but also I believe has a tooth numbing effect, that kind of thing.
And
Uh,
it's antimicrobial.
there we go. So
Hmm.
again, you
I
you
put it on my plants when I to stop
oh yeah,
fungus from growing.
oh yeah, I've seen some of those YouTube shorts. Now that
Yeah.
um, but I think what I'm getting at is our modern notions of these substances and our modern uses are so different, um, that turning to ancient texts, even from, or especially from other cultures, or modern traditional medicinal practices, might give insights into some of the things that you are hesitant to. And I'm not hesitant
Yeah.
because I'm just in my career and don't, study skeletal remains in specific. So
Yeah.
I'm happy to add further interpretation. But anyway, but thank you. It was a fascinating talk, and it's wonderful material. And congratulations to both you and Melissa for making sure that it's published and shared with the rest of the scholarly community. So thank you.
Well, with that, I would like to very warmly thank today's speaker, Dr. Rachel Kalisher, for generously sharing her research with us, and to point everyone's attention to the next talk in the series, which will be held on March 12th at the same time, 9:30 a.m. Pacific. Dr. Huli Ramatswana will be sharing a talk titled Disability and the David Narratives in Light of Armed Conflicts in Africa. We look forward to seeing you then. Thank you.